Hello and welcome to our channel Drug Diseases and Pharmacology. I am Dr. Debashree Dutta and I will be your guide throughout the content of our channel. The vision of this channel is to provide insights into human anatomy, physiology, pathophysiology and understand how drugs affect human health. Man's interaction with medicine is as ancient as history itself. As human being came in contact with nature, it also came in contact with various adversities such as wounds, fevers, diseases, even plague. And to overcome all these adversities, human beings also understood the use of medicine. So, medicine is actually the mother of science. The history of medicine is very rich. It has traversed through various cultures such as Mesopotamia, Egypt, Rome, Greece, Middle East, India to the current dominion of Western medicine or allopathic medicine. Medicine has more than 6,000 years of history. Be it the ancient Ayurveda, Chinese, or any other form of traditional medicine, some of them, which are even practiced today, has one source, that is nature. Ancient physicians used to derive therapeutic interventions from natural sources. They used to make infusion, decoction from plants, aquatic sources, minerals. So nature is actually the mother of medicine. During the early 18th century, science, basically chemistry and biology made tremendous progress. And we were able to extract active ingredients or ingredients of medical use from plants and other sources. And as we were able to extract out or isolate material, we were also able to synthesize material, and medicine shifted from nature to laboratory. Some of the very popular examples are morphine, a very popular narcotic analgesic that was extracted from Papaver somniferum, anticholinergic atropine that came from Atropa belladonna. From Nux vomica, we got strychnine, and a very popular anti-malarial drug, quinine, from cinchona, and a very popular household name over-the-counter medicine for antipyretic analgesic use, that is aspirin. It also has a natural source, that is the willow bark. With advances, like I said before, with advances in chemistry and biology in the 18th century, drugs were able to purify. Like I also mentioned before, medicine shifted from nature into laboratories. And as we were able to extract and synthesize various chemical compounds, a need for an experimental science whose purpose was to study the changes brought about by these chemicals into the living system also arose. So this is how the genesis of pharmacology came. Now the question is, what is pharmacology? Pharmacology, the term, has a Greek origin. It is derived from two words, pharmakon and logos. Logos, we all know, is used to define study. Pharmakon means either remedy or poison. Accordingly, drugs, herbs or medicines that can be used to cure diseases, prevent, mitigate diseases. Study of all these agents comes under pharmacology. More specifically, pharmacology means understanding the interaction of drugs with various systems. How your drug interacts with the cardiovascular system, with the central nervous system, with your urinary system, with your gastrointestinal tract, with your reproductive system, with your respiratory system, everything, right from its ingestion to ingestion, the entire travel of drug into the body is mapped out in the study of pharmacology. The two main parts of pharmacology is pharmacodynamics and pharmacokinetics. Pharmacodynamics define what drug does to the body, and pharmacokinetic means what body does to the drug. That means what are the changes that comes about in human physiology because of action of any chemical substance that has been exogenously administered, and what happens to that exogenously administered substance when it comes in contact with various enzymes, hormones, and blood and other components of the human body. Pharmacology versus pharmacy, that means where does pharmacology stand in pharmacy? Pharmacy, as we all know, is the art and science of manufacturing and dispensing drugs for therapeutic use. Now, as we talk about drugs, where did that drug come from? Is it source natural or was it manufactured in lab? What are its properties? What are its physiological properties? What are its chemical properties? How does it interact with various biological fluid? What happens, that is the action of drugs, what it does to the body, what is the fate of the drug, like what happens to the drug when it enters into the body. So anything, the study of source, property, action, fate, uses of an exogenously, what is exogenously administered chemical molecule, that is anything that has been given inside the body or that has been introduced inside the body from outside, is an exogenous chemical moiety. Usually we do not consider food in it, but other than that, everything is exogenous moiety. And to understand the source, properties, action, fate is the study of pharmacology. Now, for whom is this subject important? Pharmacology helps students, researchers, industrial and regulatory bodies. Specifically, in context of students, the discipline is a very important for the students of pharmaceutical sciences as well as the students of medical sciences. Researchers, for researchers who are dealing with evaluating the effect of drugs, any chemical substance, any medical device, anything. If you are researching how a particular stuff works or how a foreign entity works in the human body, the study of pharmacology is important. For industrial bodies, obviously, if you want to manufacture drug, you need to know the action that drug causes, the effect that drug has, what dose that a drug should be given in, and what are the side effects of the drug. For any regulatory bodies, to monitor the drug, they monitor the use of the drug, because like we studied like I said, the definition of pharmacology means the study of either remedy or poison. So any drug can be used as a remedy as well as a poison. Therefore, it is very essential to regulate the use of the drug. So for regulatory bodies also, the study of pharmacology is very important. Now, pharmacology, what actually is the use of pharmacology? Now, pharmacology is used to define therapeutic use of a drug. What do you mean by therapeutic use? Therapeutic use means, is a particular drug used for curing diabetes? Is it for cancer? Is it used to relieve pain, nausea, fever, or will it remedy your arthritis? What is its use? Why should I take the following drug? It comes under therapeutic use. Next is mechanism of action. How does the drug work? If I am saying this drug is going to cure your diabetes or is going to maintain your blood sugar, now how will the drug maintain your blood sugar? That is mechanism of action. Possible adverse reaction. Now, what are the side effects? Now, sometimes you might say like a physician saying you, please take this drug along with milk, it will increase its effect, or please don't take a particular drug in full stomach or empty stomach, or it will cause the following side effect. Any drug taken in more than its usual dose may become a poison or may cause certain effects in your body which are untoward or which you don't want, like cough remedies. In some of the cough remedies, it is indicated, please do not take this medicine and drive. Why? This may cause lethargy or even drowsiness. So that is the side effect of that medicine. Like anticholinergics, or sometimes if you are taking too much of ibuprofen, it may lead to stomach ulcer. So that are the possible adverse reaction, and adverse reaction are very important aspect of the entire pharmacology. Regulatory bodies need to maintain need to have a clear cut understanding of this adverse reaction to ensure proper use of the drugs. Next is therapeutic dose. How much dose a particular drug should be taken in? Below dose, it will not be of use. More than the dose, it will cause side effects. So the exact therapeutic dose of the drug is very important. And dosing interval. How long should you take the drug? Is it to be taken twice a day, thrice a day, or whenever needed? Like if you are having pain, take the drug. If you are not having pain, don't take the drug. So pharmacology helps you to define therapeutic use of a drug, mechanism of therapeutic, what it is used for, mechanism of action, how it brings about that use, what are the side effects, what is the therapeutic dose, what is the dosing interval. Apart from that, it also has more uses like defining what happens to the drug and all, but essentially these are the important functions of pharmacology. Now pharmacology is useful for pharmaceutical technology. Obviously it's the heart and soul of pharmaceutical technology. Without understanding the use, side effect, dose of a drug, we cannot manufacture it, we cannot market it, we cannot basically do anything with it. Biotechnology, we are creating vaccines or antibiotics, or we want to study the effect of a microbe on aspects on pharmacokinetics or pharmacodynamics, anything, you will need the study of pharmacology. Medical sciences, obviously, one of the major tools a doctor has is drugs and medicine. So it is of utmost importance that you know at least the uses, the side effects, and the dose. Same goes for veterinary medicine as well as regenerative medicines. Now in our next video, we are going to be dealing with Introduction to Pharmacology Part 1, and it includes definitions in pharmacology, some of the important terms which you will regularly encounter while studying pharmacology, historical landmarks in pharmacology, and the scope of pharmacology. Thank you for watching this video. Stay tuned for more such videos, and please like, comment, share and hit the bell icon to subscribe our channel. And if you have any question or any query regarding the current content, please DM me and I will get back to you. Thank you.